Hi, I'm Dr. Mary King, and I'm a pediatric ICU doc, and I'm the medical director of the Pediatric Trauma ICU at Harborview. I'm here today to orient you to the new Medic One Peds cards, which will be our new standardized approach to pediatric resuscitation for all medics in King County. This project stemmed from some pediatric simulations we did a couple years ago, where we discovered that really our approach to pediatric resuscitation was quite variable. We were using a lot of different sources for information. We chose variable drugs, and many folks had trouble with the typical Broslo tape because it carried many medications we don't carry on our rigs. It was hard to read, and it was also, the doses weren't necessarily doses we wanted to use. So instead, the medics came to me and asked, wouldn't it be great to create our own cards that included our medications that we carry and at the doses we want to give, and then also took it down to volumes so we can stop wasting time with calculations when it comes to pediatric codes. So in collaboration with King County Medic One and all of the agencies in this region, we've created these cards. So now I'd like to orient you to that. This is the index card, and really this is just to orient the user of the cards to the various Broslo colors. Really the only important information here, they're the name and the colors. I have included weights here, both in kilograms and pounds. However, one thing we don't want you to do is to take an estimated weight from a parent or from yourself and then try and create a Broslo color based on that. Really, you need to obtain your Broslo color by actually measuring the length of a child. Attached to our cards, we have a new tape. It's based on Broslo lengths, but it's much smaller and doesn't contain all the medication information. Additionally, it's only $4.95, so a lot of people can use them. So similarly, the top goes to the head and the bottom goes to the feet. So any kid who's less than 12 years old, this is what you want to use. Some pitfalls we want to avoid are not putting this all the way at the head. Another common pitfall is if someone falls between two zones, you want to actually err by choosing the zone that's bigger. So if someone measures between a purple and a yellow, you want to upsize the child to a Broslo yellow. One other important pitfall to be mindful of is if a child is bigger than Broslo green, then we should go ahead and treat that child as a small adult and use small adults' sizes and medication doses per ACLS guidelines. Okay, so from here, here's our index card. Really, it follows straight through Broslo colors. So the first one being Broslo gray, Broslo pink, Broslo red, and so on. So let's look at this Broslo yellow card. You can see on top of the card, we have listed appropriate vital sign ranges for the child, as well as fluid bolus sizes. This key information right here is for their endotracheal tube size and depth. You'll notice that we've taken away ranges. So instead of having to guess what's the appropriate size for your child, we've given you the appropriate number to choose without you having to guesstimate. The card is organized really in ABCD order. So we've started at the top with RSI. And for pediatric RSI, One important difference that you'll notice is the inclusion of etomidate. And this is consistent with new PALS guidelines to use etomidate for pediatric intubation. The one situation where you would want to avoid it is if you have a patient who's clearly in septic shock. And this would be the minority of patients, but in that situation, we would instead recommend giving a dose of midazolam for sedation. Following etomidate, we recommend succinylcholine. And that goes with the typical contraindications of succinylcholine one needs to be mindful of. And then following that, we have a full dose of rocuronium, which we would recommend providing the child following the succinylcholine, as it will wear off and the child will be at risk for an accidental extubation without further muscle relaxation. And then finally, we have doses for both sedation in the form of midazolam and pain in the form of morphine. And you can provide both midazolam and morphine at these 0.1 milligram per kilogram doses iteratively to keep your patient comfortable. You'll notice when you look closely at the card, we have multiple columns here. We have the dose in milligrams per kilogram. We have the amount in total milligrams, but then we carry it out to mils. So one really nice feature of these cards is now, instead of having to spend your time with calculation, you can say, okay, I'm going to intubate this child. This is a Broslow yellow child. I'm going to drop etomidate 1.3 milliliters. Succinylcholine 1.3 milliliters. It takes away a lot of extra time, steps, and potential for error. Of note, medications that come in variable concentrations have their concentration listed face up on every single pediatric card. Medications that do not come in variable concentrations do not have their concentration listed face up on this card. But instead, we have on the back of the card, so this is the front index card, on the back of the cards we have listed the concentrations for all medications included in all of these pediatric cards. And these are currently the concentrations carried by Medic One agencies in King County. So back to the Broslow yellow card. So following RSI, we move to cardiac resuscitation. So we have typical doses for epinephrine, atropine, lidocaine, adenosine, magnesium. Then we have shock energies delivered. And then we have dosing for anaphylaxis. And we even have a nebulized epinephrine dose for crew. So finally we come to our neuro section. So for neuro, one thing I want to point attention to is for seizure, we're going to approach most seizures at first without IV access. And so there are two options for this situation, and that is midazolam, either intranasal or intramuscular, 0.2 milligrams per kilogram. If both are an option, the intranasal route is preferred. This can be repeated twice. Similarly, if IV access is obtained, you can instead use an IV dose of benzodiazepines. But no more than 2 doses of benzodiazepines should be given without consideration of second-line agents. If a child's still seizing at that time, we recommend calling medical control and discussing second-line options with them. And we have a ceiling dose or a target dose of phenobarbital, which we typically use in the hospitals, of 20 milligrams per kilogram. Although I do understand typically medics do dose phenobarbital to effect, but we would recommend that this would be the kind of ceiling target dose that we wouldn't recommend surpassing. Also, you'll see listed dextrose, 10%, and how to draw that up, as well as Narcan dosing. So everything is really taken out to milliliters, to volumes, to avoid unnecessary time and potential errors in calculation, in an effort so you can concentrate on fixing what's wrong with your child and not spending time trying to make sure that your dosing is correct. You may notice some slight variation from Broslow in terms of endotracheal tube size and depths with the larger sizes, in terms of dosing with some medications. These slight variations were intentional and done in concert and consultation with pediatric experts in our region, including pediatric anesthesia, pediatric neurology, pediatric ICU, as well as working intimately with the medical directors for Seattle-King County Medic 1. Thank you very much for your time. Thank you very much for your wonderful care of children in the entire Puget Sound region. I hope this tool is helpful to you guys, and I look forward to learning how we can improve upon it for future care of children. Thanks so much. Bye.